Graded exercise therapy was a strategy that was employed with many patients with ME/CFS historically, and was very harmful to this community and this patient population. The essence of graded exercise therapy is increasing exercise, whether it's the duration or the intensity of the exercise, at consistent intervals over time, regardless of the patient's response to that exercise. So as you can imagine, it's basically that kind of idea of continuing to push even if you aren't feeling well. So this caused a lot of significant PEM in this population and set a lot of people back in kind of their ability to manage the condition and manage their energy effectively. At Cornerstone and in this program, we use the idea of this energy envelope, this kind of abstract concept that we have. If you have ME/CFS, you have a finite amount of energy in a day, and that envelope kind of changes size day over day. But we're constantly trying to gauge how much energy somebody has and then teach them how to effectively manage it throughout a day, throughout a week, through concepts like pacing, among other things, in order to prevent post-exertional malaise. It's important that they have rescue strategies, things like breathing exercises, complete physiological rest, which includes, reducing sensory inputs like light and noise, trying to nourish their bodies in this period of time. We can utilize the expertise of our registered dietitians in this instance in order to kind of get their body to reset and come back to their baseline. So we help patients find kind of the individualized approaches that work best for them when those crashes inevitably come. If, there are conditions that are optimized, there might be a green light to do some activity, and then there might be signs more of a yellow light where they should proceed with caution. So it is very important that we, as clinicians, are not pushing patients and that we teach them to also not push themselves. If you think that you might have a post-infection condition, would be to reach out to Cornerstone and book an initial assessment with one of our physiotherapists. In that initial appointment, which is 60 minutes long, we'll go through a full clinical history, past medical history, and look at sort of what your day-to-day symptoms look like, what your day-to-day function looks like, and kind of help hopefully give you some answers. We might not be able to give you all the answers you need right away. We need that sort of more lengthy conversation to get started.